before AdaptDx, we were realizing that pathology was being missed.
I remember that macular degeneration was just a condition that was very difficult to detect, and even once detected, difficult to do anything about it. So essentially we were watching patients go blind.
Before we got the AdaptDx, the only thing we had to go by really is looking at the fundus, looking at the retina, and looking at the OCT and seeing if we saw any drusen. But now with the AdaptDx, I'm finding patients who have early signs of macular degeneration, and normally I wouldn't have caught them because they look fine still on the OCT. So I think it's wonderful that I'm able to catch those patients before they actually show clinical signs or lose any vision. The way we determine who we're going to test with the AdaptDx is several different ways. We look at their age, and if they're over 50. We look and see if they've had any macular degeneration in their family. And then honestly, the biggest question is, do you have any trouble driving at night or trouble seeing in the dark? And if they say that, then we recommend doing the test.
The test is a test of dark adaptation, or how fast someone adjusts from day vision to night vision. So at the beginning of the test, which is done in the dark, we show them a camera flash. And that flash is about the intensity of your cell phone camera flash, and it's focal, located outside the fovea so it's non-irritating. And that's to get everyone's retinal illumination to a standardized level. After that, we present a stimulus to the patient, and whenever the patient sees this light, this small flash of light, they press a button. And of course, if they press it, it becomes dimmer. If they don't press it, it becomes brighter. And so what we're trying to measure is the least amount of light they can see at a given point in the time. And after what we measure is called a threshold, they have a rest break. And over time, they can see progressively dimmer flashes of light, and we can track out what's called the dark adaptation function.
We did a short study for about a week, and we found out that 72% of our 50-year-old and older patients had trouble driving at night. And when we did that test, 41% of those patients did not pass, which was shocking to me, just shocking. And I was glad for it because now we can do something to prevent those patients from losing vision, but I was completely surprised.
We were very shocked when we had the data pulled at the end of the week, and we had noticed that of the patients that were selected to do the test that were over 50, 40% had failed AdaptDx.
In school, they teach us that macular degeneration is generally a disease of the elderly, that it is a disease of patients who have lighter set eyes, fair skin, patients over the age of 50, etc. With the AdaptDx, it has just completely opened my eyes as far as what we don't know about this condition. With macular degeneration, it's no longer a disease of the elderly. It is no longer a disease that is only for patients who are lighter set eyes or Caucasian. With AdaptDx, I pretty much have diagnosed patients who are below 50. I have also diagnosed 2 patients now with macular degeneration, and they are African American. One over the age of 50, one below 50. And so it is just changing entirely what we know about the condition, and I'm able to just learn so much more about the condition and be able to treat. It really has changed my whole view because it makes me feel amazing to know that I can actually be a part of this preventing blindness. I'm not just doing exams and seeing what's there right now, but I'm actually helping with the future.
I think this day and age, as we embrace technology, early detection is it's crucial. It's catching pathology before it becomes permanent and has life-altering consequences. So we've noticed that patients are very thankful and grateful, and they have also passed on the information to family members and to their loved ones. And so we find that not only has it helped us as doctors caring for our patients' eye care, but it's really made a profound impact in patients' quality of life from a long-term perspective.
The AdaptDx has really helped me care for my patients. It has helped me find macular degeneration a lot earlier and be able to proactively treat this for my patients. I really believe strongly that if we can catch these patients at this stage and be really proactive with recommending supplements, blue light filters, sunglasses, telling them to watch their BMI, their cholesterol levels, that we can stop or slow down this so much that they can maintain their vision the rest of their life. And I mean, that's what we're here for, right, as optometrists, is to maintain vision and give people the best vision we possibly can. So that's just right along with what we're supposed to do as optometrists.
As far as the AdaptDx in diagnosing and patient stories that we have, pretty much I had two sisters who visibly had no signs on their photos. No symptoms, no complaints, but because they had a grandmother who went blind from the condition, I went ahead and convinced them, hey, let's do a screener. We did the screener and they tested positive for it. With that, I have created some very, very loyal patients. I am now seeing that entire family, and they are completely appreciative that we are catching this at much, much earlier stages. Needless to say, they're actually in their 40s. So being able to prevent any sort of blindness for them is highly emotional, as far as it's just one of those things that just makes a world of a difference in a patient's life, and it makes me feel so grateful that I can do this for them.
AdaptDx has definitely made us feel much more confident in diagnosing AMD. It was the missing link. And I feel like it's just a big piece of the puzzle that we haven't had in our arsenal for many, many years.
Now that we have the AdaptDx, it's made a world of a difference in diagnosing patients, because it just gives us that yes or no information, so a lot easier to make that decision now with the AdaptDx.
The first thing I say when I walk in the exam room is, okay, good news, bad news. Bad news, you didn't pass the test. Good news is you didn't pass the test, which means we caught it early and we can preserve your vision for the rest of your life. I always print up this little sheet of paper and I sit side by side with the patient. So if they're sitting in the exam chair, I pull my stool up right next to them and I put this in front of the two of us, and I go over everything that is important for slowing the progression of macular degeneration. I said, if you do all these things, we're going to keep your vision. If you do everything I tell you, and I'm going to see you back in 6 months, we're going to see how you're doing, okay?
For me, diagnosing macular degeneration before there's visible signs, it's a positive thing. So when I approached them, I said, hey, yes, you did test positive for macular degeneration. The amazing news about that now is we know to prevent we know we can prevent blindness. We can make these lifestyle changes. We can start you on macular vitamins, and we never have to get to the point where anyone has to see you go blind.
I think as the AdaptDx technology becomes more widely implemented and embraced around the globe, we're going to see AMD being caught much sooner and preserving quality of life and vision.
With the AdaptDx, we're going to uncover just so many more patients that we did not already know about. So I think it will aid a lot in being able to catch those patients a lot sooner before they even have to worry about different types of treatment like injections to the eye or any sort of vision loss.
Well, I really think that once the AdaptDx gets widely implemented, that we're going to see a significant decrease in vision loss with macular degeneration, because we're going to catch it early. And as we find out more and more about how to treat these patients, especially these early macular degeneration patients, there's going to be a pill, there's going to be better supplements. We're going to know more about how to stop this progression.
As we catch more pathology using AdaptDx, we are going to notice that not only are we caring for our patients, but we're going to notice that we are driving more follow-up visits, and practice revenue as a byproduct will increase with the use of this technology. We found that using AdaptDx in the office has made us better clinicians and has improved the quality of life of our patients. I honestly can't see myself practicing without it at this point.
I love having the AdaptDx in my practice. The ability to catch macular degeneration before any true clinical signs occur is huge. So I would recommend it for anybody to get in their practice.
I would strongly encourage our membership to embrace the AdaptDx technology. We're all going to catch AMD much sooner.